Moral injury. The psychiatrist Jonathan Shay coined the term moral injury for experiences where someone who holds legitimate authority has betrayed what is morally right in a high-stakes situation. Brett Litz, more recently, defined it as perpetrating, failing to prevent, bearing witness to, or learning about acts that transgress deeply held moral beliefs and expectations. These experiences lead to cognitive dissonance with internal attributions of blame to oneself, experience of shame, guilt, or anxiety, and withdrawal from others. And over time, these lead to isolation, suicidal thoughts, self-handicapping behaviors, and suicide. In terms of treatment, some of the treatments for cognitive therapy actually may not be appropriate or may not work here because cognitive therapy identifies beliefs that are exaggerated. But in some of these cases, the beliefs may not be exaggerated. They may be based in reality and the experiences. So trying to change them may not work. So what both emphasize here is a therapy which involves the community, listening non-judgmentally to the person, accepting, understanding the person, and the person feeling accepted, engaging in taking full responsibility for whatever they did, and then thinking about how their life now and in the future would be meaningful. In terms of hypnosis, here's some examples of guilt and shame and how to deal with them. So survivor guilt can be addressed in trance by having the patient meet with the injured or deceased person, say in trance what they wanted to say at the time but didn't, and listen to the response of the person. Because this is not just a cognitive exercise, but an actual experience in trance, it brings relief much of the time, whereas talking about it and thinking about it did not.